In 2008 I was diagnosed with Parkinson's disease, so I thought I'd sell up and come to Brisbane to be near my family. Well, I was seeing a neurologist in Brisbane, but see, it took a whole day for me, leaving here in a bus and going up to the Mater, and at 8 o'clock I had to get the bus, and then at 12 o'clock was my interview for half an hour. I had to wait till 4 o'clock to get the bus home, which meant a whole day away for half an hour. So I definitely think that telehealth is suitable for the elderly, especially for bedridden patients that can't get access or difficulty getting people to see a specialist.
Older people often have difficulty in travelling to see specialists, and because there are relatively few geriatricians, and because of the time involved in geriatricians visiting older people's homes or visiting aged care facilities, effectively older people can't have much service from geriatricians. So because of this, we've built a service using video conference to enable geriatricians to consult with residents of aged care facilities. There's a couple of benefits. First of all, everyone who's involved in the care can see the same information at the same time, and this really improves communication and understanding of the solutions. Secondly, because the case is so well prepared, the geriatrician spends much less time in fact-finding and allocates much more time to talking about solutions with the patient, with family members and with nursing staff.
Morning, Mrs. Stockhill. How have things been?
So the telehealth service enables me to review frail and vulnerable older people in their own environment, so they don't have to travel up to hospital to access specialist services. So the general practitioner prepares a report, and then the nurses do a thorough assessment of the patients across really important areas. I've been quite surprised at how well patients have been able to adapt to this medium of providing a health service. So some of my patients will have problems with their vision and hearing, which make communication difficult, but they're still able to understand me clearly over the television screen, and the nursing staff value the ability to access the expert opinion.
I think there's many benefits to the telehealth service. I think for the staff, it's the opportunity for them to actually be sitting in with the geriatrician and hearing firsthand. Sometimes when people come back with information, it's not always exactly as the specialist may have meant it to be. And also keeping the residents in our care so that they still have the medication, they still have their meals, and we can still be monitoring their situation is very beneficial.